Today on the occasion of Doctor's Day, we have with us renowned consultant cardiologist of India, Dr. Rahul Patil, on our show AM Morning Riser to guide us on how to keep our heart healthy and tell us more about why heart attacks are more common in the morning. So welcome Dr. Patil.
Yeah, hello.
Hi. My first question to you is, Doctor, is it true that most heart attacks happen in the morning?
Yes, research has shown that the most common time of the day for heart attacks is generally in the morning. And also there are certain studies which have shown that the heart attacks which occur between 6 a.m. to the noon, that is during the morning time, they are happening to be more serious heart attacks which with worsening consequences.
Doctor, my next question to you is, what are the warning signs of a heart attack?
Yeah, if we go by the American Heart Association recent guidelines, any chest discomfort, tightness, heaviness or pain which lasts for more than 20 to 30 minutes, then it has to be, medical opinion has to be sought for any such symptom. Many times we get many atypical symptoms like giddiness, breathlessness also, especially in elderly people. So any such discomfort or abnormal sensation which lasts for more than 20 to 30 minutes, I think it's always safer to seek a doctor's opinion.
My next question to you is, sir, what causes early morning heart attacks?
Basically, our body has something called as an internal body clock, which we call as a circadian rhythm. And the researchers have found that somewhere towards 6 to 7 a.m., as a part of this circadian rhythm, there are a lot of changes happening within the body. Like there are a lot of hormonal secretions and certain secretions called the PIA1 cells. And all of these changes lead to increased clotting tendency during that particular time of the day. So ultimately, all of these together will lead to increased risk of heart attack at that time of the day.
So you mentioned that sleeping well is important. Could you recommend which sleeping position is best for your heart?
Yeah, there cannot be an exact definition of a good sleeping position. It depends on various cardiac conditions. Like for instance, in a patient with heart failure who has breathlessness on lying down straight, he is obviously advised to sleep with a little bit of head end elevation. That is, we give him 1 or 2 pillows on the head end side and little bit of head end elevation. There are other conditions like obstructive sleep apnea, where there are extremely obese people who have respiratory problems while sleeping straight. So such people are advised to sleep towards their right side. So practically, although not completely proven, theoretically probably we can say that in a normal person who's slightly overweight, probably sleeping towards his right side could be a safer option.
So my next question to you is, how do you prevent morning heart attacks?
Yeah, I think the simplest and the most easiest way is to sleep well. Minimum of 7 to 8 hours per day of good sleep, I think, is the most easiest option. Then another most important thing is stop smoking, avoid excess alcohol consumption, eat a heart healthy diet, check your weight and lose excess weight if necessary. And also, as we know, the most important point nowadays in this urban lifestyle is that to reduce the amount of stress in your life as much as possible. And also, nowadays in the urban lifestyle, there is another important point wherein the consumption of illegal drugs like cocaine and certain other habitual drugs has to be stopped, since it has been shown that many of them have the risk of heart attack.
My last question to you, sir, would be, what lifestyle choices will help keep my heart healthy?
Yeah, as I mentioned, a good sleep is of utmost importance, around 6 to 8 hours of sleep every night. A healthy and balanced diet, which is predominant of fruits and vegetables. Avoid junk food, quit smoking, that is one of the most important points. Reduce your alcohol intake, do regular exercises, manage your stress. As of late, I think that has become one of the most important risk factor for heart disease. And generally, any person who is overweight for his height, I think it becomes very important to come down on his weight, and then he can follow his normal regular diet.